Good morning, welcome to the Green Hour. Every Wednesdays here at 10 a.m. Our previous episodes are up on YouTube as we speak on the FM91 YouTube channel. Through all our episodes, what have we been talking about? We're talking about climate change and how there's drastic, extreme weather conditions, droughts, floods, landslides. And in the midst of all of this, the mission globally to go carbon neutral by 2030. One of the institutions leading this mission, we've got the Khan University as one of the first universities and healthcare providers in the geographies in which it operates to have net zero carbon targets that are aligned with science and this global mission. Joining us this morning, Global Senior Management for Environment and Sustainability, Miriam Kugele joins us. Good morning, welcome to the Green Hour.
Good morning. Thanks for having me here.
So that's carbon neutral, net zero, fancy words, jargon that is thrown in publications and interviews. Before we get into your mission and how you've been doing it with the AKU and its network, what do we mean exactly when we say we're going carbon neutral?
Great. Yeah, super good question, especially as you correctly recognize there's a lot of jargon. And sometimes that's for a good reason, right? Politicians love to confuse us, and this is, in a sense, a political discussion worldwide, and has been for nearly 30 years. And of course, corporations have really got onto this as well, right? And love to throw out this terminology to, sometimes do good work, but sometimes also do a bit of greenwashing and look great. So yeah, we really have to look at, who's doing the work to make all of this happen. Now, what does all of this mean? Carbon neutral, net zero, etc. What it really means is that we recognize climate change is real. We recognize why it's caused, the anthropogenic or human causes, and that is humans emitting more greenhouse gases than the planet, the oceans, the atmosphere can absorb. Right? So in a sense, we're accelerating the greenhouse effect, which actually makes our planet livable in the first place. Right. But we're accelerating that by emitting more greenhouse gases. So that can be carbon dioxide, that can be other greenhouse gases. And there's a whole range of them that have different kinds of impacts and stay around in the atmosphere for different times. And so most of this emission comes from the burning of fossil fuels. Right? That's the most obvious source. So driving cars, producing electricity, industry, etc. Right? And so now going towards carbon neutral or net zero really means that we recognize that we must reduce those emissions going forward. Right? So we must stop the excessive amounts of emissions going out. And the world has really set itself the target in 2015 through the Paris Agreement that countries came together and signed in 2015 to minimize the heating of the planet, the warming of the planet, to a maximum of 1.5 degrees since pre-industrialization. Right. Now, what does that mean, or where do we stand? The planet has already warmed by 1.1 or 1.2 degrees Celsius. So that's actually sounds quite small, but I think we're seeing it not only here in Karachi and in Pakistan, but also what we hear in the news from the UK and Europe these days, or the wildfires in Australia and the Americas, etc. Yeah. That really these kind of impacts are very real and they're accelerating very quickly. I think most of us have seen it in our own lifetimes. So the Paris Agreement set itself this 1.5 degree target, right? Countries signed up to this. And so what scientists behind that calculated is how much are we allowed to emit in the next years, decades, within the century actually, in order to reach that curve. Right? So we recognize that the planet will currently continue to heat up because there's a time lag. We drive our car today, but those emissions have an impact tomorrow.
There's a lingering factor.
There's a lingering effect, a time lag effectively, because until those emissions kind of have that impact in the atmosphere, it takes a bit of time, right? So the planet currently will continue to heat, but scientists have calculated how much greenhouse gases we're allowed to emit over the next years and decades in order to stay within that 1.5 degree limit. And so countries have come up with with papers or commitments of how much they are willing to reduce their emissions from a business as usual scenario, right? Yeah. Pakistan has also made such a commitment. Actually, end of last year at COP26, which is the convention where the countries come together, has made such commitments. In the case of Pakistan, though, it's conditional commitments, so conditional to receiving international financing. Other countries have committed, for example, to become net zero, so really to significantly reduce their emissions, by certain timelines, most of them by 2050, so middle of the century. And then let's get to the real question, what does net zero mean? So net zero means when we have reduced our emissions in line with science, so that significant reduction, and then compensate for the residual emissions, right? So there will be some emissions we will always produce, right? But we can compensate for them. The obvious example is planting trees, right? Trees sequester or draw down that carbon from the atmosphere, right? I think the important term that I really want to emphasize is in line with science, right? So many companies, many countries, many actors make these net zero and carbon neutral commitments, but don't necessarily follow the same curve, the same decline that is actually required for the world to not completely overheat and for life on Earth to be still possible.
I mean, that is a huge undertaking. When you look at it, it's almost overwhelming. And so I'm curious, how then, as AKU and the Development Network, I'd imagine that something as huge as this would occur in phases. It's not something that you can implement, right? So I'm assuming that's what's happened with AKU and the Development Network, which is your mission. Tell us how this is kind of played out, how you suspect or expect it to play out with AKU and its mission, and what is that mission?
Yeah, so the point about phases is very important. Though one does have to realize that one can't just kind of sit back and say, oh, we'll do it next year, or we'll think about it in 10 years' time when maybe technology will be ready. Those are actually all lame excuses. In a sense,
when the government will be ready.
When the government will be ready, that's right. So in a sense, we have enough information to act now, right? And that's important because we, as I've just told, there's a time lag, right? So we don't really have time to act, and that's really why it's we call it a climate emergency. So the first phase of undertaking emissions reductions, or called mitigation, is actually to measure your emissions, right? To know what your emission sources are and to understand where your emissions hotspots are, and then take action accordingly. So at the Arhan University, as part of the Arhan Development Network, we started on that carbon accounting process, the measurement of our emissions, about 2 years ago, right? And since then, we've measured our emissions on a quarterly basis. It's probably worth mentioning that the international standard to do that is on an annual basis. But we wanted much more refined data to be able to take action more specifically. Right. And so we started measuring our emissions actually by creating our own tool to do so. So this measurement of emissions is quite a complex based in science type of undertaking. And at the time when we started this, there was no tool, no framework for emissions in healthcare to be fully captured. So we actually developed our own tool, which is based on the international protocols of how carbon accounting happens. Right. And we also innovated a bit in this tool to say, well, we also want to calculate costs, right? Of what does it cost to make changes and what maybe...
Cost to mitigate.
Cost to mitigate, but also cost savings, right? Because, for example, when you're saving on energy, you're actually saving cost, right? So there's a cost reduction element to it as well. We also wanted to be able to benchmark. So, for example, understand when we have a fleet of cars or a register of different buildings of infrastructure that we have at AKU, for example, which building is more or less efficient. Right. So knowing all of this now, having done our carbon accounting, we know where the hotspots are. So we know, of course, that energy is our biggest emissions source. We know which buildings we should focus on because they're the bigger emitters. We also got some surprises in this process, of course. So, for example, example, we didn't really expect that the use of anesthetic gases was quite as significant as it is.
Really?
Anesthetic gases is something that occurs in the healthcare sector quite specifically, right? Other sectors wouldn't have that. Similarly, refrigerant gases, when you top up your AC, that sometimes has to happen, those are refrigerant gases, and they're very destructive, right? They're really bad. And so actually that is a very significant emission source, given the vast amount of buildings we have and operate at AKU. So there were surprises, and this is really important to recognize. So that first step is really that carbon accounting. What we also learned in that process is that the absolute biggest part of AKU and within the network also emissions are actually from the supply chain. So they're not from our direct operations.
Right.
They're from the stuff we buy. So the obvious stuff we would think about is maybe computers and whatever else, but in a hospital or in an operation that has healthcare in it, like ours, we purchase a lot of pharmaceuticals and surgical equipment, etc. And actually, we purchase quite a lot of it from a lot of different places. So to give you the number, AKU alone has about 5,000 suppliers, right? And so we plugged all of this into our calculator, into our carbon tool.
Comprehensive data,
Yeah. So quite a fun process, and now really understand even in our supply chain what the hotspots are. And while we don't have direct ability to change our supply chain, we do have the ability to work with our suppliers and engage with them and encourage them to undertake.
Good morning. We're speaking to Miriam Kugele, Global Senior Manager for Environment and Sustainability, working with the AKU and the AKU Development Network in helping them become carbon neutral. And we were discussing just before the break how they've assessed some of these hotspots at AKU, AKU globally, I'd imagine, and established some of the data, which was very comprehensive. But what next? That was phase one, is what we established. Is okay, let's collect the data. And now we've got all of this data. We know the buildings that are affecting, and the supply chain is part of the problem. And that's where you come in, Miriam, correct? And
that's right.
And they go, listen, here are the documents. You figure it out. And how do you figure it out?
Yeah, that's actually where things get really exciting. So as I just said, we monitor our emissions on a quarterly basis. So we have quite a good idea, when we make a change, then if we reach that impact. But how do we make changes, right? So now that we know our emissions hotspots, and I just mentioned in our actual operations, energy is the obvious one. It's the biggest one, right? Well, then we look at, what consumes energy in our operations? So in a very large hospital operations, and we operate in 6 countries, that is AKU operates in 6 countries, that's quite complex, right? So we literally look at every AC and every light bulb and every big piece of machinery from MRI to CT scanner, every laptop, etc., and kind of assess, where is the biggest amount of energy being drawn, right? And then, of course, we work with our procurement team, for example, and our facilities team, and the engineers and the kind of technical experts, and say, are these the most efficient pieces of equipment we could have? And very often, that's not the case. So I'll give the example that we'll all understand, which is your AC, right? So at home we might have some inverter ACs because we spend a lot of money seemingly on that, and we might still be running some relatively old non-inverter ACs. Well, turns out your inverter AC is about 30 to 35% more efficient, meaning it consumes about 30% less electricity. And this is the good news, right? While it might be slightly more expensive to invest in that in the first place, you actually lower your electricity bill. And everybody wants that because that's reduced costs. And especially these days, as electricity, fuel, etc., cost is going up, we really want to do that. So what I'm doing is assessing with all these teams across the university where we can make changes and upgrades to our equipment, right? That's the one kind of change in equipment, from high energy consuming equipment to lower energy consuming equipment. And as I just said, there's a lot of that, right? Then, of course, we also look at renewable energy. So we say, well, instead of procuring electricity, buying electricity from the grid, there's actually now very feasible, very cost-effective options to produce our own, and that is renewable energy. The obvious example being solar panels.
Right.
And now, even in Pakistan, it's really wonderful. The last few years have really changed a lot here, that you don't even have to buy solar panels and pay for them up front. You can actually kind of lease them and have what's called power purchase agreements, etc. So there's different financing models where actually you don't have to have upfront capital. And this could even be interesting for a household, right? It doesn't even have to be at the scale of an institution. And by producing some of our own solar or renewable electricity, we again reduce our carbon footprint or our emissions, right? Then there's a kind of third area of action. So the first was lower energy equipment, the second was renewable energy, and the third is kind of practice changes. And most of these actually don't cost money. And so, for example, we look at how can we reduce waste? Waste produces a lot of emissions. How can we maybe turn off the cooling of a building at times when it's not used,
right?
Or cool, like we have a large tower at AKU here at Stadium Road. So how can we maybe, when people work after hours, only cool 1 or 2 floors and everybody clusters in those floors and have shifting desk situation in the evenings, but actually turn off the cooling in the rest of the building.
Yeah.
This costs us no money. It's actually energy management, right? In anesthesia, it's a bit similar. I said earlier, anesthetic gas emissions are a significant source of our operational emissions. And again, practice changes can be done, by using our equipment in a different way. Or instead of anesthetic gas for anesthesia before an operation, to use intravenous methods. So these are practice changes. A lot of them don't really cost money. What they take is creativity.
I'm just curious, because you said earlier also that the supply chain was a huge contributor.
Yeah.
So I get it that you could perhaps replace equipment, and the stuff that you have control over.
That's right,
so to speak. But then how do you manage or sort of bring the supply chain into it? So listen, for example, the refrigerant gases.
Yeah.
How do you then speak to supply chain?
Yeah, I'm glad you're asking, because it's a bit of a different way of doing things. So there are these two main areas of emissions. Are operational emissions, where we have direct control. We can change which AC we run, etc., right? But on our supply chain, we only have influence, right? So we can't expect our suppliers to change their processes or give us lower carbon products, right? But we have influence. Given how big of a consumer we are, and how much money and power, therefore leverage, we spend in the system, we can talk to our suppliers and encourage them, right? So one of the things is really just starting the conversation. And that's been quite exciting, right? And we've had quite a lot of interest, actually, especially from our local suppliers. So within the countries we operate, let's say in East Africa and in Pakistan, for example, where suppliers are actually saying, yes, we're interested because we know this is an important agenda, because there's all this ESG reporting requirements and such, right? So they want to learn, they want to start doing the right thing. And then we can, of course, change our own policies, right? Which we're starting to design, right? We're not quite ready to really design that policy change. But then effectively a policy change would say, by X date, we will only procure from suppliers who have their own net zero targets. Or by X date, we will only procure from suppliers who do their carbon accounting, right? As I said, that was step 1.
Yeah.
Right? And so then we do have direct influence on our suppliers. Now, that sounds pretty scary for most of the companies that we work with.
Yeah.
But there's good news again, which is that a lot of our international suppliers, the big international pharmaceuticals or others, they're actually already undertaking this and way ahead of what AKU and AKDN and at large are doing. And why are they ahead? Well, partially it is because law in the countries where they're based, let's say in Europe, for example, already requires them to do that, right? So I'll take the example of Germany, where by law, again, the country has committed to be net zero or carbon neutral by 2050.
Right.
And so expects now all the companies within this geography to follow suit, right? And again, there's reporting requirements and such. So all those companies actually are already starting or have already started their journey and have already reduced their emissions of their own operations. So what does that mean? It means when we buy a product from that company, we already get a lower carbon product.
And you're buying into that sort of like-mindedness.
That's right.
We're on the same sort of objective and trajectory.
That's right. And so not only does that reduce our emissions, but it can also say, well, you supplier who are already doing your sustainability work, can you please speak to our local supplier? We'll get you into one room. We'll facilitate a conversation. Because we're AKU and a large consumer, we can kind of do that and facilitate and expedite actually this learning process. And so it's really exciting. We're really at a really interesting time where we can facilitate such conversations and make significant changes.
What is the target? Is there a sort of like a bullseye, a target? What is that target?
There is, and it's quite long term. So most people find that quite scary or difficult to deal with a long-term target. So the net zero target for the Arhan Development Network and therefore for AKU is 2030. Right, so that's still a few years to go, but it's important that it's such a long-term target because it's quite the endeavor, right? What it means for the world, though, is that really the world must decarbonize and become net zero by 2050, right? So that means there's absolutely no new emissions by 2050. And of course, these targets have been set by science and calculated such that the world doesn't warm to hopefully more than 1.5 degrees.
What is the what is the current scenario with AKU since sort of you've embarked on this mission? Where are we at right now?
Yeah, so we're as I say, we've accounted for and calculated our emission sources. We've designed a kind of a way forward towards the 2030 target and identified opportunities for renewable energy, for reducing our energy consumption and therefore emissions, for changing some of our practice, for engaging with suppliers. And now we're really at the stage to kind of start implementing. So part of this is finding the funding sources for it, or finding new and innovative ways to fund it. I was talking about different ways to fund solar panels beforehand, so that for example, and then starting to implement. And of course, a large part of that is also capacity building, right? So a lot of what I do is have these kind of conversations with a lot of colleagues to really train and facilitate, everybody being able to use their voice and taking this forward. Fortunately, at the Arhan University, we have a really wonderful supportive leadership for this agenda, and that's absolutely important, not only in this geography, but generally when you have that kind of visionary leadership that says this is an important institutional and strategic priority, then we can really make a difference.
Very interesting that we've, mitigation is something you've said since the start of this Green Hour segment. What is the difference between adaptation and mitigation?
Yeah, great question, and I'm sure a lot of our listeners today will be interested in asking themselves. So it can sound a bit technical, but it's not necessarily technical. So they're kind of two parts of how we can deal with climate change. Right. Both of them very much recognizing that climate change is here, it's with us, it's already with us, and we need to do something about it. Right. So adaptation kind of recognizes that there are changes to come, or there are changes already with us and changes to come. Again, I'll mention heat, extreme weather events such as precipitation or rain, and many others that we kind of need to deal with. We need to figure out how to change our routines and our life in order to actually cope, right? So coping is a part of adaptation. Okay. A bit of a simplistic example is, it's hot outside and I'm going to switch on my AC to make myself comfortable. It is a correct adaptation method. Is it necessarily a good one? Maybe not, because we consume more electricity. Electricity, again, produced largely from fossil fuels, having more emissions and therefore accelerating climate change, right? But there's other ways to adapt, for example, in terms of our buildings, right? And that's really important. So the way we construct buildings, construct and design cities is really critical to how hot it gets. So there's this thing called the urban heat island effect, which means that cities trap heat, right? Because the wind can't flow through our streets very well, because there's so much concrete, dark surfaces absorb the heat and then radiate off that heat. At the same time, in cities in particular, in Pakistan also, we're reducing the natural infrastructure, greenery, right? And so that means that there's less opportunity for that heat to be absorbed by the vegetation. There's also less opportunity for soil to absorb the rain. And we just saw that a few days ago in Karachi, right? Yeah. Which is one of the reasons it floods. Actually, all our surfaces are carpeted, right? The water literally can't be absorbed by the soil. And so thinking about how we restructure our urban areas, how we build more like better buildings for a specific geography, those are methods of adaptation, right? On the other hand, we have mitigation.
Correct.
Right? And mitigation, as I've mentioned earlier, is the sense of reducing the emissions we put into the atmosphere, right? In order to reduce climate change from accelerating or getting ever worse, right? And I've spoken about a few of the examples how we can do that at an institutional level, but even at a household and individual level. Yeah. And I think that's really important to recognize that we each individually, in our institutions, in our cities, have ways to help be part of the solution, right? We shouldn't really be complacent because we have methods both to adapt and to mitigate.
It's interesting that you say be a part of the solution. Throughout our segments in the Green Hour, we've often talked about countries who are vulnerable or have been put into a position of vulnerability, like Pakistan, and those countries that say we are vulnerable, like Pakistan, say, well, listen, it's not just us. It's not my responsibility. It's not our responsibility. You did it. You put this out there, and we are now, a part of that sort of affectees and affected. And so why is the onus on us? And I think what you say is very interesting is that, yes, well, it's our responsibility as well. You may be vulnerable, or you may have been put into this position, but you believe otherwise.
Yeah. So there's that term of historical justice that you're referring to. That's what we call it in the climate space, right? And it refers to, since pre-industrialization, most of the countries that have emitted more and contributed more to the problem in the so-called global north, Europe, North America, etc., are really the ones who are, in a sense, responsible for causing most of the problem. Right. So in Pakistan, we currently emit less than 1% of global greenhouse gas emissions. So yes, one can kind of step back and say, we're not really a big part of the problem. But I think one can break that down a little and say, well, where is Pakistan today, and where does Pakistan want to be in its development trajectory in 10, 20, 30 years? And of course, the population is growing, and the population is developing. Everybody wants to drive a motorcycle or a car or cool their house, right? And so actually the energy needs are ever increasing. And then the question does become, well, how do we provide for that ever increasing energy need? Do we, for example, put a new coal power plant online, which emits large amounts of greenhouse gases? Or do we support renewable energy going online, right? And so those are the kind of policy and institutional decisions made probably outside of our scope. But in a sense, even as citizens and residents of this country, we do have some influence over this. So for example, where do I invest? Right? And where do I put my money, right? And how does the bank then reinvest that? Right? That actually really influences on what, where the banks give loans to which kind of corporates to do which kind of energy resources. So I do believe that even as individuals, we have quite some power there to influence the larger picture. So that's kind of one part of the story. And the other part of the story is, again, coming to a healthcare perspective. So when we look at healthcare emissions, we realize that the intensity, the carbon intensity of healthcare in low and middle income countries such as this is actually higher than the carbon or emissions intensity of healthcare, let's say, in the global north. Okay. What does that mean, right? It means that actually the same kind of operation in Pakistan emits more greenhouse gases than the same kind of healthcare operation in the global north. And why is that? It's because the electricity grid here is quote unquote dirtier, more carbon intensive. It's because our transport network is like less efficient, it's because we need to run generators, right? Again, dirty fuels, fossil fuels being burnt in generators, much more because there is electricity shortfall, and a few other reasons. So what that means is actually that our healthcare operations here has an even higher responsibility to do something about the problem than it would elsewhere. And of course, as a healthcare operation, we treat people who are sick and really should actually prevent them from becoming sick in the first place, right? So this whole discussion about air pollution, etc. So that moral responsibility on the health sector is really quite dire in a sense.
It's time now for our quick fire round. You ready?
Ready
to rock and roll. Your first question: biggest cause of environmental pollution in hospitals?
Well, the biggest source of emissions in our operations is energy use, right? Healthcare operations are very energy intensive, but even bigger is in a sense all the stuff we buy, so our procurement, our supply chain, right? That's really the largest source of emissions, not only for AKU, for any healthcare operations. We just deal with our supply chain a little differently than we're able to directly change our own operations.
What do hospital suppliers need to do in the future?
Well, they should really start their own sustainability journey, right? I mean, everybody literally should, but our suppliers as well, right? So just coming back to this idea of carbon accounting, right? Knowing where the problem is really enables you to make a difference. And it's not only a problem, it's also an opportunity, right? So wherever you consume energy, you spend money. And that's an opportunity to actually save money. And who doesn't want to save money?
Top health problems for Karachi related to climate change.
Yeah, I think recently we will have all thought about the tremendous rain and the flooding situation, which is really a public health problem afterwards, right? Because of all the garbage floating around and all of that. Heat, of course, is another one, and I'm mentioning that specifically because the way we design our city, the way we green our city, the way we build buildings, the way we commute, all of those things actually are in our control and have a direct impact on how hot it is and how livable, therefore, in our city.
Top things to tackle to improve this?
Well, in a sense, there's many things we can do on an individual basis, and maybe that's how I'd like to conclude this also, to say, we don't have to wait for policy changes. We don't have to wait for better technology. There's really many things we can do on an individual and everyday basis, whether it's carpooling to work to reduce the number of cars driving around, whether it's having a cotton shopping bag in your purse so that anytime you spontaneously go to the supermarket, you avoid that plastic bag. Whether it's reducing your AC temperature, actually increasing, from 16 degrees to 24, 25 degrees, which is completely comfortable, right? So these are just a few examples that we have in our everyday life that I don't think we need to wait for better science, better policy, or anything else.
One of my biggest takeaways is the accounting, the self sort of auditing, carbon auditing, even as a household. How many plastic bags am I using throughout the day, and when am I turning on the air conditioner? Do I need to turn it on right now? And what that's what I always try to bring it back, because if I can bring it back to myself and to my household, then it makes sense. And so, what would you say to anyone that's listening or watching? How can they sort of begin this process of sort of carbon accounting for themselves? So
there's tools online that can be used. Most of them, in fact, all of them that I'm aware of, are not for this geography. So wouldn't necessarily be using the data from the Pakistani electricity grid, etc. But by proxy, they would still be good to use to get a sense of where the biggest emissions in the household are. And there's many such calculators online. But then even just actually taking a slightly different approach and not even thinking about the emissions, but thinking about from a cost angle, right? Where do you spend money? It's on a flight ticket, has emissions, right? It's on fuel I put in the car, has emissions. It's on the electricity bill, has emissions. So actually using cost as a proxy can also be a good way to think about where there's high cost, there's emissions.
That's interesting. So where am I spending money most?
That's true.
As sort of a gauge of
as a proxy.
What needs attention right now. I like that. Miriam Kugele, Global Senior Manager for Environment and Sustainability from the Aga Khan Development Network, Aga Khan University. Thank you so much for joining us. It's great to have you.
Thank you for having me. This has been great.
This is the Green Hour. Reminder that previous episodes are up on our FM91 YouTube channel. We'll be back again with another episode of the Green Hour.